Hello, I'm Dr. Donald Hill at Medical Arts Clinic, member of the Jefferson County Hospital Foundation. And today's program is going to be a little bit different than what we've had in the past. We're going to look at a typical sequence of events of what happens when you come into the hospital to be admitted to the hospital. So oftentimes we get questions about how things are billed, what goes on behind the scenes. So today we're going to do a little illustrative patient inquiry and take a patient through the process of admission, and then what happens after admission, and also a time of discharge, and how your hospital visit is billed out, how insurance might be reimbursed on your behalf, and to try to cover some areas that I know that we've had addressed to us in the office and in the hospital itself with after hospital discharges that may answer some of your questions. We do have the kind volunteer today of Judy Cox, who will be our patient, and we'll take you through some various departments, and then toward the end try to explain the billing process. So we want to thank you for watching the program today, and once again put a plug in for the Jefferson County Hospital Foundation, which is supported by your contributions so that we can do programs like this and programs in the community, which you've been seeing evidence going on at the present time. So we'll meet with you a little bit later with our first patient.
Hi, how can I help you today?
I am not feeling well at all. In fact, I think I probably need to see a doctor.
Okay, so you're going to go to the emergency room today?
Yes, I am.
Have you been a patient here before?
No, I'm visiting from out of town.
Okay, what's your last name?
Gas.
And your first name?
Judy.
Now, is that your real name, Judy, or is it Judith?
It's Judy.
Middle?
I don't have one.
Your birth date, Judy.
I'm too old.
Okay, I'm going to need your birth date in order to get you into the system. Your street address, Judy?
I live on 1000 Bulky Cheese Avenue. Did you know that I live also in Wisconsin, where it's the cheese factory of the world?
No, I didn't know that.
Yes.
What's the city that you live in, Judy?
Monroe. I
And
eat a
that's
lot
Wisconsin?
of cheese. Yes, I eat a lot of cheese. I think maybe that's part of my problem.
And your phone number there?
555-3076.
And the area code, please.
641.
And your social security number?
555-001111.
Your marital status?
Widowed.
State you were born in?
Iowa.
Are
I
you
travel a lot, eating a lot of cheese.
Are you allergic to any medications that you know of?
Not that I'm aware of. My doctor will probably tell me that today.
Do you have any insurance, Judy?
Yes, ING.
Do you have that card with you today?
No, I do not. It's in the car. I suppose I could have someone go and get it for me.
That would be really helpful if we could have that, so we can get the billing address off your insurance
Okay.
card.
I can get it to you later. Do you need to have
That'd
a
be
copy of
fine.
that?
Yes, we do need to make a copy.
Do you know how long this is going to take? Because I am really feeling like I need to go somewhere.
We're just about done here, and then we'll send you down to the emergency room. I need to know who to notify in case of emergency.
My doctor?
Okay, what's your doctor's
Me,
name?
Dr. Hill.
And is that here in Fairfield?
Yes, it is. Medical Arts Clinic.
And are you employed anywhere, Judy?
No, I'm retired. I eat a lot of cheese laying around on my deck.
It'll be just a minute for this to print, and we'll get your signature on it before you go down.
Thank you. I need help.
We want to give thanks to the little stage act we had here on admitting the hospital, but some of the common questions we get is, why do you have to fill out all that information before you come to the emergency room? And if it was a true emergency, they would have been going through that process at all. That patient would be directly wheeled back to the emergency room, and then we gather data as the examination evolves as we're able to. But the reason we have to have that information is, one, is to have access to know who to call if there's something to happen on an emergency basis, such as a phone number of a nearest relative. Also, we also list your address, things to get our file established, which will be for permanent record here at the hospital. Also, we get some birth dates. We get an idea what your age is when we come back for the examination. And it sounds like like getting the insurance is a real driving factor, but the hospital's under so many regulations that these are things that they have to ask. They really don't have much choice about this. So we always ask for your patience as they go through these questions when there are times you may not be feeling so well. And if you're not feeling well, perhaps a spouse or a loved one in your family can give that information as you're being wheeled back to the hospital. So there are a lot of regulations they have to go through as to why they do this, and we do ask that your consideration and your patience when they go through that process. But once again, be reassured if it's a true emergency, you don't have to go through this process, and it can be, the information can be gathered in retrospect. Then maybe a fade out. We're now in the exam room here with, what was your name again? Was it?
I'm Judy Gass.
Judy Gass, excuse me. Yeah. I thought it was flatulence there for a second, but
No, I
okay.
changed.
Anyway,
Got
we're
remarried.
we're in an examination room here at the Jefferson County Hospital. And at this time, they've taken her back to an examination room whereby the time that I see her, the nurse has already taken her blood pressure, pulse, her temperature, respirations, and taken a brief history as to why she's here. And Judy, to my understanding, you've been having some tummy pain for at least 3 or 4 days anyway.
Definitely, yes.
And been throwing up a little bit,
Vomiting, yes.
not holding down fluids very well at all.
No, and great pain in my abdomen area. there.
Okay. Your what area?
My abdomen.
Abdomen area.
Yes.
And at this point, I would do an examination on her based on the brief history we take, and we take a lot of other things to try to tie in where we might be getting for working diagnosis. And the form that she filled out at that point, I've got in my hand because the nurses have registered those vitals I talked about. So I've got something already on a preliminary basis to start working with on my assessment with Judy here today. And so she's talked to me about her nausea and vomiting, abdominal pain. Have you had any changes in dieting or eating habits lately?
Well, as I had told the girls at the admission desk, I have been on a cheese diet for like maybe 4 days. Do you think that could be a part of the problem?
It's very possible. Any fruit or vegetables?
No, I don't like fruit or vegetables.
And do you kind of go on these binge eating type diets pretty frequently?
Very frequently, because I'm trying to reduce the size of my body.
Okay.
Do you think these diets are going to be helping me, this cheese diet?
If
I've
you're
been
eating
on?
Swiss cheese, it might work because there's lots of holes and it might work.
Okay.
But on the purpose of that questionnaire was that we try to get some ideas what might be instigating the problem. But one of the common things we get in a hospital is when someone thinks they need to be in the hospital, we have to look for certain criteria to get that person in the hospital because in the insurance industry, Medicare, Medicaid have criteria as to what allows you to be admitted to the hospital. To simply say, I want to put you in the hospital, Judy, because you're a nice person and I believe what you say, doesn't crack it up at all. You have to be able to have some criteria on physical examination and the history to allow to be admitted for the hospital for observation or for direct admission to the hospital. So one of the things that will help Judy get in the hospital is, besides having abdominal pain, is she's having nausea and vomiting where she can't hold things down, indicating that she will probably need intravenous access with an IV, which are one of the qualifying features that can allow us to put a patient in the hospital. If I just put her in the hospital bed and lay there and look at her, they say that she can do that at home, doesn't need to be put in the hospital. So those are why we go through these questions to evaluate the patient, but also to get criteria per the record, per that form we filled out initially, that when an insurance company does a retrospect look at that hospitalization, to know that you had the criteria to actually be put in the hospital. So Judy, if it's okay with you, I think we're going to put you in the hospital tonight and run you through X-ray and lab on the way up to get some preliminary information. Would that be okay with you?
Sure, that would be fine, as long as I get to feeling better.
Let's hope we can get that done. After that's done, she then signs this form that I've got in my hand saying she's agreeing to be admitted to the hospital. So the paper process goes on. And that's a regulation also. We hear this all the time. You go in, you sign your initial form, then they come back down and say you got to sign the form again because another provisional step of therapy is being entertained, which is admitting her to the hospital, what she's saying she's giving permission for us to put her in a hospital. So we're going to fade out now. We're going to go to the departments so we can look at what goes on with the billing process in those departments. We're back again, and we're now in the radiology department. And today we have a familiar face from prior programs, Linda Marley, who's head of our radiology department here at the Jefferson County Hospital. And she's been privileged today to talk to Mrs. Gass today about her dilemma and what we're going to be doing for x-ray that I've now ordered for her. And we want to show you what has gone through and why we do this as far as the forms are concerned for getting the x-ray done. Linda, why don't I just let you lead the way and kind of show us what has to be done.
Okay. I'll be going over the consent form with Ms. Gass. This is a consent form for giving intravenous contrast or x-ray dye to our patient to highlight the blood vessels and internal organs that she has during her CT scan. The form itself has an explanation for patients describing the risks that may be involved with having intravenous contrast and the risk of an allergic reaction, what they can expect. We don't want this to necessarily alarm them. It doesn't necessarily mean these things will happen to them, but we have to let them know of the risks involved prior to giving them the contrast. So I'll be going over this. There are a few standard questions that we ask prior to injecting intravenous contrast. And so, Judy, I'll just ask you a few questions if you don't mind. Have you ever had x-ray dye before?
No, I have not.
No, you have not. Okay.
So what does that involve? Like,
It involves...
do I feel anything?
You may feel something. It'll be an injection through a vein in your arm. You may get a warm flush feeling. Some patients experience a little nausea. That's why we ask all of these questions ahead of time.
Do you have a basin for me in case I would get sick?
Yes, we do. We are fully prepared in case you would get sick. There's a basin available. We'll provide a cold compress. There are medications available in a drug box in the CT scanning suite in case you would have a more severe reaction. And of course, we have physicians here in the hospital. Dr. Hill is here with us, and Dr. Gleich, our radiologist, would be available in the event that you would have a contrast
Will I be put to
reaction.
sleep?
No, you will not be put to sleep. You'll be fully awake for the entire exam. The technologist will talk to you during your exam, explain things to you, and then you may be asked to hold your breath at certain times while you're being scanned. You'll go in through the scanner a couple of times, once for a pilot scan, and then go back through in a slower manner for an actual scan of yourself. Then they may inject the contrast and take you back through yet a third time.
And this won't hurt?
It's completely painless other than the needle stick for the injection. Having the scan itself, you lay on a table, which is actually quite comfortable, and you just have to lay still for it. The scan itself will not take very long,
I hope
10 or
not,
15
because
minutes.
I am in great pain.
You are in great pain. Well, we want to alleviate that great pain. Now, can I finish asking you the questions that are related to the contrast media? Do you have asthma?
No,
Okay. Are you allergic to anything that you know of?
no,
Okay. Do you have a history of heart disease?
No.
Are you a diabetic?
no.
Okay.
I'm on diets though. Does that have anything to do with diabetic?
No.
Okay.
No, it doesn't. Any history of renal failure? Kidney failure?
Maybe today because of this problem, I'm not sure.
Okay. Any history of sickle cell disease or multiple myeloma?
I do not understand those.
Okay. If you don't understand those, you probably do not have them.
All right.
Any other debilitating diseases that we should know about?
No,
Okay. Have you had any previous surgery in the area that we are examining? Any abdominal
I've had
surgeries?
children.
Okay. Any surgery with that? Did you have a cesarean
No.
section? Okay, so no previous surgeries. Okay, that takes care of the information that we need to give you the intravenous contrast. And Pam will be coming to get you for your scan here in just a few minutes.
Do these things you talk about, do they, like allergic reactions, do those happen very often here?
No, they're really not very common. We use a contrast called non-ionic contrast, which reduces the risk of an allergic reaction to our patients. And we really don't see very many reactions anymore. In the past, the contrast that we used to use, there was a larger risk for it. Sometimes our patients would get a warm flush feeling, nausea or vomiting, or break out in hives. And once in a while we would have a more severe reaction, but now we see very few reactions at all.
That's reassuring, because so many people have concerns, you know, they don't want to die in the process of figuring out something else is wrong with them. I hear you're on a diet. Are you on a diet?
Yes.
I'm on a diet right now too. Matter of fact, I'm on 2 diets.
Really?
I went on one diet, but I wasn't getting enough food on one diet, so I decided to add a second diet so I get enough to eat.
Good.
Maybe that's why I'm not losing weight too well. Well, let's fade out and go and look at the CAT scan. Just show briefly the CAT scan, and then talk about how we get this billing process done.
Okay. Okay, Ms. Gass, this is Pam. She's our CT technologist, and she'll be putting you on our table for your CT scan.
Hi, I'm pleased to meet you.
Nice to meet you too.
I certainly hope you take good care of me.
This should be relatively easy for you.
Now, this is really a nice CAT scanner. And I know, well, this is something we're very proud of at Jefferson County Hospital. I know the employees are really proud of this also. It's one of the newest, fastest CAT scanners they make. And how long has it been here in the hospital now, Linda?
This was installed in October of 2001.
It's been a tremendous help for making diagnosis of these patients on a rapid fashion, and especially with Dr. Gleichman here on a daily basis, we have full-time radiology coverage to help make the interpretation. How's it feel down there, Miss Gass?
Boy, I'm getting up here pretty high. I'm getting scared.
Well, just don't pass anything along the way here. Normally they'd be in a gown in this case, but because Miss Gass is a little shy, we're going to leave her in her clothes here today.
I'm really cold and I don't feel very good, doctor.
Pam, I'm sure will cover you up because Pam's very kind.
There you go. How's that, Judy?
Thank you very, very much. I think I'm going to get sick. Do you have anything for
Yes,
me?
I do. I have a pan if you need one.
Would you turn that other way there if you do there for me, Miss Gass?
Okay.
I can pass a tube down her nose into her tummy and make her tummy feel better that way. How about that, Miss Gass? Would that be okay?
I know.
Are you feeling better now, are you, Miss Gass?
Yeah,
Okay.
yeah.
Okay, Judy, in order to see your blood vessels and some of the organs in your abdomen, we have to give you this dye. And it'll go in through an IV in your arm, okay? Which you probably already have. We usually have the nurses put those in for us. I'm going to hook this
They
tubing
did that
up.
earlier.
Yeah. I'm going to hook this tubing up to your IV.
Is this your contrast material here, Pam? Well, that's
This-
pretty fancy.
This is colorless and odorless. You won't even know it was there. You may feel a little bit of something as it's being injected. But if you have any problems breathing or you have any pain in your arm where it's going in, you let me know right away because I can stop it right away, okay, if we need to. And I'm going to have you put your arms above your head for this. Up on the pillow for me. That's it.
Say
Like
we.
that.
Wee.
Now you're going to be moving in and out of the scanner a couple of times while we take your films. The scanner has a voice that will tell you when to hold your breath, okay? Okay. Are you comfortable?
Except for my stomach still hurting.
Okay.
Yes.
This won't take very long, so hopefully we can get you off of there and they can get you something for your stomach.
Thank
okay?
you.
How long will this take, Pam?
Less than 5 minutes for the scan.
Okay.
Okay. I'm gonna
So are you going to shoot one view anyway, Pam? Can we do that?
I'll just simulate
Okay.
a scalp film.
Okay. Why don't we do a scalp film and then we'll take a look at your scalp film, Miss Gass.
Okay, here we go.
Hold your breath, Judy. Doesn't take very long at all. And as Pam said, it would take at most 5 minutes to scan the entire abdomen pelvis. Is that true, Linda?
Yes.
Not very long to look at all the organs and blood vessels in the abdominal area and the pelvis. You feeling anything, Judy?
No, I feel nothing. It's just
Okay.
very comfortable.
Okay, good. Well, why don't we take a look at this scalp film and see how Judy's looking here. Is it on the film? Do we even have any film placement?
No, we didn't.
Okay.
She's just
We don't have any
submitted.
scalp films or anything.
I can put one up, but
Okay. Well, in that case, we have an example. We could show them when it goes up on the screen. Can we pull one up without confidentiality? They won't be able to see the name.
sure.
Why don't we take just a quick break and look at see what shows up on the TV screen in the other room than when we're getting a CAT scan. So Pam, this is kind of a screen you're looking at, and then
This is the actual scan here.
okay,
Shows some of the internal organs. This is the liver.
this part right here is the liver.
Mhm. And it scans all the way down through all the organs.
So you're working your way down the body as we
Uh-huh.
go along here.
Mm-hmm.
Internally, we're seeing the arteries, the veins, the
Some
bones.
bowels and kidneys.
This would be your kidneys right in here.
Mhm.
Mhm. And that was all done within a 5-minute time where we take all those
Mhm.
pictures of the abdomen with no pain, minimal radiation,
Mm-hmm.
with a lot of information. And so then you take copies of all these pictures and put it on a printout for the radiologist to look at then?
On a film, on films.
Okay. Now, I guess at this point, the reason we're here today is to talk about billing and what goes on then. How does this get billed out, Linda and Pam, as far as we have now this then that goes to radiology interpreter, but from the business office standpoint for insurance, what happens? Do you do that through a computer or do you have a paper?
We have an order entry system that we enter all the patient charges, goes directly to data processing for the billing. All of that information is matched up with the patient's demographics and insurance information. Then medical records takes our information from our reports, puts it together to do all the coding, and then it's submitted to the insurance companies for billing. With radiology, we also have additional charges that come from Radiology Consultants of Iowa for Dr. Gleich, who's the radiologist, for his interpretation of the film or his portion of the procedure.
So there's two charges, one for the x-ray and then one for the interpretation fee
Yes.
also.
One is for the x-ray or the procedure, and one is for the interpretation or the physician performing the procedure.
And I know that's sometimes an area of concern from patients because they don't understand it when they get their bill in the mail, why they get two different bills.
It is often confusing, particularly when they get a bill from Radiology Consultants of Iowa, because they are billing from Cedar Rapids, and they don't really understand why they're getting a bill from Cedar Rapids. But the company that we use for radiologist services is based out of Cedar Rapids, and Dr. Gleich actually works with that group.
He's their employee?
Yes.
Okay. And so do it through the computer, then it goes to the business office, and then that's how they get their fees. How do you get your fees? Like, how do I know you aren't sitting at 5 times what the normal price should be? How do you arrive at your fees?
Fee schedules are very closely calculated based on usual and customary charges. We reference the Medicare manual for reimbursement so that we know that we're not out of line for what we charge our patients.
So there's an actual manual that tells you what's a reasonable fee.
Yes.
And then you go by a local fee around surrounding hospitals and then a regional, like what's customary for Iowa, besides the Midwest United States and national, is my understanding.
Yes.
So that way you know your fees are reasonable and fair to the patient.
And fair to the patient, and that's what we want. We want to be fair to our patients, as we know there are competition in other areas, and
Sure.
we want to set our charges appropriately.
In my understanding, we have so many contracts with insurance companies, they oftentimes tell you what they're going to pay for that, and that's how you set your fees also.
That's true. Particularly, insurance companies will ask you to accept payment based on their schedules, and then of course Medicare also has a fee schedule for the things that they bill, and in the Medicare system for the older patients that have Medicare.
So the Blues may have $800 thing, and so we charge $850. We'll accept the $800 because we contract with them.
Depending on what the contract is, yes.
Okay, alrighty. Why don't we fade out now? Let's get our patient down the lab, and then we're going to get her up to her room so we try to get her more comfortable.
Okay.
Thank you. We're now in a patient room, and Judy's been placed to bed. And so oftentimes we think about the nursing care coming on, and it's a very important part of Jefferson County Hospital, as are many other ancillary services that we're going to have a brief exposure to here shortly. But one of the things that patients don't often realize is how much paperwork is involved with the nursing staff and taking care of you as a patient in Jefferson County Hospital. It's really an important role, but from a patient care viewpoint, it's the least important role for the nurse because they're mainly concerned about your well-being. We have Jane Adrian, who's been here at Jefferson County Hospital for a few years. I think you were here before I came to Fairfield, Judy. Probably don't want to admit to that, though, do you?
Yeah,
Or Jane, not Judy, but Jane. And
I've been here 32 years.
And Jane is, I said, an experienced nurse. But when they get up to the floor and we're helping try to make this patient comfortable, what are some things you're doing from a paperwork standpoint? I know you're going to get the blood pressure and the pulse and respirations and temperature. Once again, from what the emergency room has already done,
Yes.
with that form we brought up from the emergency room, which we got initially at the front desk. But what are some things that you're doing, and why are these important?
Okay, we need to find out what the main complaint is of Judy. And we need to find out if she's having pain, and if she is, we have a whole set of doctor's orders that we will follow. And usually pain relief is the main thing that we try to strive for at the first part, after we get the blood pressure and all of the vital signs. And we also do like a weight and a height. And then we go and ask what the patient is allergic to as far as medications. And then we need to know, like, what are your specific complaints over the last, say, week, or since the time that you've been having the pain or whatever you're coming to the hospital for, your main complaint. And so we have a form that we follow, and we put all of the symptoms and so forth on what your main complaint is. And then we go through all of your past medical history, and we find out what all of your main problems have been over the last, say, 5 to 10 years. Find out what kind of surgeries that you've had, any allergies, like I say, to medications, so that, and then we look at the doctor's orders to make sure that the doctor hasn't ordered any of the allergies that you're allergic to as far as the medications, because occasionally, doctors get kind of busy and they sometimes will write maybe an allergy in as far as a pain medication or something, and so we try to pick up on those things, and then we'll call the doctor if that problem arises. And then we ask like any other allergies, and then also what kind of medications that you have been on, like through the last month or two. And we write down
It looks like, Gene,
dosages.
you've got about 2 or 3 pages of material you have to go through to just find out. So basically, you're repeating everything the doctor's done besides for your own benefit.
Yes, correct. And we want to make sure that we take care of the patient, well, Judy, the best way that we can, and make sure that they're comfortable. And we try to see, all of their needs. And we try to make sure that they know how the room functions as far as the bed control and as far as the nursing call lights and the TV and all of the different functions of the room.
Make sure things, acquaint them to the room so they understand what's
Right.
going on in the room as far as
Correct.
how to move the bed, how to turn on the
Yes.
TV.
Mhm.
One of the most common questions we have to ask, though, that's sometimes an uncomfortable question, is DNR status.
Right.
What is that? Can you explain that to the audience, who that is, Jane, and what it means?
Yes, that DNR means do not resuscitate. And as an elderly patient or a patient that has had cancer or any other, some kind of a terminal problem, we might ask the patient if they would like for us to resuscitate them. It's kind of a hard question for me to ask. I think that's the hardest question on my form that I have to ask. And so sometimes I sit down and hold their hand and ask them, and I make sure that they understand that this isn't something that I'm just imposing on them, but the state of Iowa requires that we do ask this question. And so I try to ask it in the nicest manner that I can for them to understand.
And it is important to respect the wishes of the individual, and it can be someone 40 years of age you have to ask.
That's right.
But it is a difficult question, but we're required to by the state to ask that. Many of these questions you've asked are not requirements, it's just good nursing practice.
Right.
But that's one of the few questions we have to ask because of regulatory guidelines, just as the paperwork we did at the very beginning are under regulatory guidelines that we have to follow too.
Correct.
So Jane, at this point you've checked your IV, you've gone over your med list, you go back now and you write up a whole new chart, don't you?
Correct.
And how much do you think of your time that you spend is due to paperwork?
Oh boy, I would say, at least fourth of the day.
And beforehand, compared to 20 years ago,
Oh, much, much more.
at least 2 or 3 times more than what it was.
Oh, yes, at least 3 times.
Because we've noticed
more.
the same thing that we
Correct.
had in medicine as you have also experienced.
Correct.
So Judy, we'll try to make you more comfortable. And I think after I've done your examination, your history, it would appear to me, Judy, that you have more of an eating problem than you do anything else. Because I think you're bound down from eating too much cheese.
Oh, no.
So your last name, Miss Gas, is quite appropriately because I think we need to be starting to think about some way to relieve your stomach discomfort. Even a colonoscopy might be a possibility. And that's how we define how long truly a minute can be. So I think at this point, Jane, I'm going to do some things. And would you care for a drink of water or anything
Oh,
like
yes,
that?
yes,
or
yes.
so
I need a drink of water,
Okay.
but golly whiz.
I'm going to let you have that. But
Oops,
oh, I'm sorry, you did spill some there.
I'm
I'd say
so sorry.
it's not a
I'm sorry
problem.
about that.
oh.
Jane realizes we've got good housekeeping to come in. Do we have housekeeping around here at all, Jane, that can come clean the spot up for
I
us?
can come check and see.
I'm
if there
sorry.
is.
But behind the visible team that we see in the hospital are a lot of people working behind the scenes in Jefferson County Hospital.
And clean up this water spill, but the patient accidentally caused a little bit of a spill on the carpet here, and so we need you to go and get something so we can clean that up.
So we want to kind of give you a couple examples of how things are worked
Doesn't
behind
my
the
TV
scenes.
work? I need something to distract me from
Well,
this
we'll
pain.
check it out in here. Hello, what's your name here? We're going to get you on a spot here. What's your name here?
I'm Jerry
Well, Jerry what?
Nordyke.
Nordyke. And how long you been in Jefferson County Hospital, Jerry?
A little over 2 years.
2 years.
Mhm.
Getting experience now. And your Department of,
That's okay. That's okay. Don't worry about it.
is it
That's what we're here for.
housekeeping or what's this called? Environmental
Services.
Does that mean housekeeping?
Mhm.
Okay, so you do all the cleaning up and everything else here.
Mhm.
But this is something you don't often see in the hospital. Very, very important. Because we want our hospital clean, we want our patients comfortable and feel neat, and all these government guidelines you're under also, aren't you, for how the cleanliness of the hospital, because you're inspected too, aren't
Oh,
you?
yes.
They come in and see how good a job you're cleaning, and then they give the hospital a grade.
Mm-hmm.
We've had very good grades on that. So at this point, you're in here to clean up that little water spot because Miss Gas got a little clumsy with her water.
I'm sorry.
That's
So
okay, don't
sorry.
worry
But
about it.
thank you for
That's-
coming in.
that's what we're here
You're
for.
so very kind and sweet. Thank you.
No problem.
So thank you. Nice
you go.
meeting you. And at this point, just want to emphasize many services behind the scenes that you don't see because her job's not to spend a long time in the exam room for confidentiality. So they oftentimes don't work. They work when you don't realize it. The family oftentimes don't see these individuals unless they're vacuuming the rug down the hallway. So thanks for being here and thanks for helping Judy out.
Thank you.
I don't know if the TV's going to work or not. Where is the TV control in here? And see if that's going to work.
It's on this here.
This is probably one of the
Some
most
blue button.
complex things in the hospital to figure out how to do.
It is.
And as I push the button, it doesn't appear it's working, Judy. So do we have maintenance that can come and fix things out?
Yes, we do.
Is there anyone from maintenance around here that could help us out? So, are you with maintenance?
Yeah, I am, Doc.
And what's your name, sir?
Larry Mitchell,
And what's your job description?
head of maintenance.
So it says chief engineer. So you're the boss man here then.
I guess so.
So your job is to more or less fix things when they get broken in the hospital
That's correct,
and do some preventive maintenance too.
if we can.
So Judy says her TV's not working. Are you the one of the people that they're going to come in and fix that for also?
Yep, myself and one of the other maintenance guys.
So you're the ones that fix the beds, you fix the air conditioning, fix the heating, you fix the electrical, plumbing, the groundskeeping, the whole thing.
Yep, that's correct.
There again, very important on how things are done in the hospital to make sure we get good patient care. Do you recognize this gentleman here, Miss Gass?
No, I don't.
Okay, well, this
I'm
is
too
Larry
full of it.
Mitchell. Been here for a while, head of our department, very nice person. Well, thank you for coming in, and I'm sure you'll get the television fixed for Miss Gass pretty soon.
We'll get that done right away, Doc.
Thank you, Larry.
Thanks.
So at this point in time now, I wanted you to get an idea about some of the backgrounds, people that are working to help on your patient care. But what I also want to tell you is that those job services are included in a global fee for hospital care. During the day, my understanding is you're charged a daily fee for hospital care for use of this
I
room.
need to know this.
And all those services, housekeeping, maintenance, dietary, or all your meals, nursing care, are all under that fee for daily care in the hospital.
That'll probably show up on my hospital
Yes, it
bill.
will. So it's more than just a hotel room. All those fees are considered into that global fee, whether it be, I don't know what a daily charge at the hospital even is. Do you even know what it is?
I don't come to the hospital.
I don't even know what it
have
is,
to,
but
yeah.
that includes all these different people that are doing that work. So that's why it's more than just a customary hotel fee. But I do have it arranged for you to talk to a dietitian just briefly about your diet, and maybe get some ideas on what you might be doing better than eating just strictly cheese to get rid of this gas abdominal pain and then relieve your nausea and vomiting that you've been having.
Okay.
Let's see if we can get the dietitian in here, please. Well, hello, come on in.
Hi, Ms. Gass.
Hi.
And what's your name?
I'm Christy Thompson. I'm the dietitian.
How long have you been here now, Christy?
I've been here since October, just about 8 months.
Well, thanks for coming in. Anyway, at this time, I've written for a consultation for Christy to come in and talk to Judy about her diet because all Judy eats is cheese.
Oh my goodness.
And just some ideas that what you do when you come in and talk to the patient, what's involved, and why do you need to talk to this patient?
Well, Judy is having some trouble with constipation, so I brought her some prune juice and some high fiber nature bars to help to relieve her constipation.
I have to drink that whole pitcher?
No, you don't have to drink the whole thing.
Okay.
Just a little bit every morning would help. I also brought you some information on a high fiber diet, and if Judy were my patient, I would sit down and talk with her and explain which foods would be best for her to eat to avoid her constipation.
Well, thank you very much for helping Judy
You can
out.
have that.
And this is something that when Judy goes out of the hospital, she can make an appointment with you to come back in, review dietary habits, and give her some more guidelines and counseling too. Is that correct?
She sure can.
And because we do utilize that service at our hospital with our diabetics and people of low sodium diets, a high fat diet, that to try to reduce fat, Mikey's high fat diets, we'll have her come in and talk to our dietitian so they get proper counseling on diet, more than just give them a diet sheet. So thanks for coming and welcome to FPAC.
Well, thank you. Did you want to
Thank
keep
you
your
for
prune
coming
juice?
Thank you very much.
Thank you. There again, that service is under that global room fee charge that you get for one of your services. In prior shows, we talked to you physical therapy, respiratory therapy. We've gone to the X-ray department, but this is one of the departments that's very important also for your well-being because she also helps on planning the meals daily, is my understanding, for the patient, and setting up special diets when you have special diets that are needed because of your health problem. In your case, Judy, it won't be any cheese in your diet.
The one thing I like is I can call for room service. Look
Thi-
at that.
This has been a nice addition.
Yeah.
So when we have patients in the hospital, they know exactly who their nurse is, who the nurse assistant is, and how to dial room service to order their meals. Is that what that's for?
If you want to have a meal delivered at a time other than
Okay.
the normal times, and if they want to select off of a certain menu, they
And
can.
there is a whole menu, just like a cafeteria style. And you just look at it like about an hour or so before you want to eat, and you look at it, and if it is prescribed on your diet, then you may have it. And the dietitian will, after you call down, which is 346 at the hospital,
Yes.
then she will decide then if it's already on your diet that you may have, and then if it isn't, she'll call and let you know that
Can
you
I have
need
a
to select something
cheeseburger?
else. Now, we better not have cheese.
No cheeseburger?
Well, anyway, at this point, let's assume that now you're miraculously better. Let's finish up this. I want to go down to medical records and show them the stack of paper.
Okay.
Talk about how billing is done so they understand some of what goes on after you're out of the hospital,
Okay.
which can be one of the most confusing things to our patients.
Is this where you like dictate?
This is where we're supposed to be dictating our records and keep up on our records, yes.
Okay.
Which, by the way, I probably have a gold star for the community
Probably
because I
do.
keep up my records. So let's fade out. Let's go down to medical records and show them the volumes of paperwork, what's involved, behind the scenes, what it takes just to take care of you in the hospital.
Thank you.
I decided before we went down the medical records for Judy to show the paperwork that's involved, to have a short discussion with Mary Klein. I'm going to ask you to have a brief discussion with her about different levels of care that we have at our hospital that are administratively different, that have a response on insurance billing that explains some of the differences to you. Mary, would you kind of explain who you are and how long you've been in Fairfield?
I'm Mary Klein, and I do what's called utilization review. Nobody really understands that term, so it's just easier to explain to people that I am the go-between between the insurance company and the physician and the patients. Our goal here at Jefferson County Hospital is to try to keep the physicians happy and the patients here as long as they need to be here, and the insurance companies as well, which isn't always easy. And I've been here 16 years.
Oh, you're a long timer through then.
Yeah, 16 years.
But it is true about Mary. She helps us a lot on trying to negotiate with these insurance companies. If I feel I need a day or two longer with a hospital stay, she gets on the phone, makes the calls, and says, well, we need to keep those patients in the hospital longer.
Right.
So she's really an advocate for you as is the hospital, because we want to keep you in here until we think you're safe enough to go home.
Right.
And there's tremendous pressure by the insurance industry to get you home because it means saving them money.
Right.
Medicare's a little bit different, though, Mary. How's that work?
Medicare is different in that when patients come over from the doctor's office or from the emergency room, need to be admitted to acute care, which is what Judy is on right now, she is not a Medicare patient, but if she was a Medicare recipient, Medicare pays for acute care as long as the physician lets me know that you need to be here, you're sick enough to be here, and that usually isn't a problem. When the patients are better, but not well enough to go home yet, they'll go to skilled care, which means they stay in the same room. The patients usually don't know any difference. What it means is that the patient is better, not well enough to go home, and the room rate is about half of what it is on acute care. Those patients can go to skilled care as long as they meet criteria. If